In this lecture, we will explore diagnostic errors, medication safety, surgical errors, documentation accuracy, root cause analysis, error reporting systems, patient safety culture, ethical considerations, human factors, error communication strategies, legal implications, and quality improvement initiatives in healthcare. Let's get started. Diagnostic errors in healthcare can have serious consequences, including delayed or incorrect treatment, worsened patient condition, and even harm or death. Factors contributing to misdiagnosis include inadequate clinical knowledge, cognitive biases, and system failures. Medical professionals must recognize these factors and implement strategies to reduce errors and improve patient outcomes. Medication errors are dangerous and can happen during various stages of the medication process. Illegible handwriting, wrong dosage calculations, drug interactions, and inadequate knowledge can contribute to these errors. Healthcare professionals can improve patient outcomes by using computerized prescribing systems, medication reconciliation processes, and strict medication administration protocols. These strategies help minimize the risk of medication errors. Surgical errors can have severe consequences, ranging from patient morbidity to mortality. These errors can occur due to miscommunication, equipment failure, lack of adherence to standard protocols, or lapses in surgical team coordination. It is crucial for healthcare professionals to understand the causes of surgical errors and implement preventive measures such as surgical checklists, team communication protocols, and continuous training and monitoring. By following these strategies, patient safety can be enhanced, and surgical errors can be reduced. Accurate and comprehensive documentation is essential for ensuring continuity of care, communication between healthcare providers, and legal purposes. Errors in documentation can lead to miscommunication, incorrect treatments, and compromised patient safety. Healthcare professionals must prioritize impeccable documentation practices, including thorough and timely recording of patient information, adherence to standardized documentation guidelines, and proper documentation of medication administration and outcomes. By improving documentation accuracy, clinicians can contribute significantly to patient safety and minimize errors. Root cause analysis is a methodical approach to understand the causes of medical errors. It involves identifying immediate causes, analyzing contributing factors, and determining root causes to prevent similar errors in the future. Techniques like the 5 whys and fishbone diagrams are used for this analysis. Error reporting systems are important for identifying and analyzing medical errors. They allow healthcare professionals to report errors confidentially, promoting proactive patient safety. These systems collect data on error patterns to identify improvements and prevent future errors. Collaboration and shared learning improve patient safety. In order to prevent medical errors and adverse events, it is crucial to develop a patient safety culture. This involves healthcare professionals having a collective mindset focused on identifying and addressing errors, promoting open communication, and learning from mistakes. Prioritizing patient safety and valuing transparency allows organizations to view errors as opportunities for improvement rather than sources of blame or punishment. Within the field of medical errors, ethical considerations arise when healthcare professionals weigh the importance of maintaining patient confidentiality against the need to disclose errors for the sake of patient safety and trust. These considerations require adherence to ethical principles like benevolence, non-harm, autonomy, and justice. Establishing guidelines for error disclosure and providing proper training and effective disclosure strategies are crucial for upholding ethical standards while ensuring patient safety and trust. Human factors, encompassing cognitive biases and ergonomic principles, significantly influence the occurrence of medical errors. Cognitive biases, such as confirmation bias or anchoring bias, can lead healthcare professionals to make subjective judgments or overlook critical information. Ergonomic principles focus on optimizing the work environment to support safe and efficient performance. By understanding these human factors, healthcare professionals can mitigate their influence on decision-making and create environments that minimize the occurrence of errors and promote patient safety. Effective communication is essential when disclosing and managing errors to patients, families, and other healthcare providers. Open and honest communication builds trust, facilitates shared decision-making, and promotes a culture of safety. Healthcare professionals must master effective communication techniques, such as active listening, empathy, and clarity, to convey information about errors, address concerns, and collaborate on solutions. By employing these strategies, professionals can mitigate the emotional impact of errors and work towards preventing future ones. Medical errors can have legal implications that vary by jurisdiction. Understanding the legal framework surrounding errors and adverse events is critical for healthcare professionals. Legal considerations involve issues of negligence, malpractice, informed consent, and patient rights. It is essential for healthcare professionals to be familiar with legal requirements, maintain accurate and timely documentation, and effectively communicate with legal entities when necessary. By navigating the legal landscape, professionals can mitigate legal risks and ensure patient safety. Quality improvement programs are integral to enhancing patient safety and minimizing errors in healthcare settings. These programs involve ongoing monitoring, assessment, and improvement of healthcare processes. Integrating error prevention strategies within quality improvement initiatives ensures continuous evaluation, identification of vulnerabilities, and implementation of targeted interventions. By adopting a quality improvement mindset and incorporating error prevention as an integral component, healthcare organizations can strive for excellence in patient safety and provide high-quality care. In conclusion, medical errors are a major threat to patient safety and have negative impacts on healthcare outcomes. By addressing various factors such as diagnostic errors and medication safety, healthcare professionals can work towards reducing errors and improving patient outcomes. Establishing a culture of safety, effective communication, and ethical practices will lead to safer healthcare environments. Thank you for your attention, and I hope this lecture has provided valuable insights into the world of medical errors.